trying to get pregnant for about 4 years. With 4 years of failed success, we decided to explore some of our options, which is where we did some research and found Dr. Doody. Went to his office, and kind of, I guess, went through the motions of identifying what was the root cause as to why we weren't getting pregnant. Problem was more my problem than hers, and identified that IVF was our only option.
In this particular instance, the difficulty was related to a sperm issue. When we treat couples that have sperm or really any other identifiable fertility factor, we'd like to directly correct it, but in certain situations it doesn't respond to hormonal treatments or there are no real good surgical options. So in this case, we did do in vitro fertilization on the couple as well.
When we got to the point of prepared for the IVF, she had gone through the egg retrieval, which we had 9 eggs, of which 7 were identified that were able to be fertilized. At the time of the transfer, we only had 1 egg that was eligible for transfer, of which he gave us a less than 15% chance of success.
So what we do is we take the sperm individually into a little needle, a little glass needle, and we place it into the inside of the egg so that fertilization can happen. It's a very effective treatment. Initially, when it came out, there were a lot of concerns that we're bypassing nature's protective mechanisms. Maybe this race where 1 million sperm would compete to be the one to win the races would make a healthier baby. But it's really turned out that babies conceived through ICSI, or intracytoplasmic sperm injection, really are as healthy as babies conceived naturally. So they went through the IVF ICSI process, and fortunately they wound up being successful.
When Dr. Doody came in, my first question to him was, do we move forward or do we, Control-Alt-Delete and back up and start over? And his quote, and brought tears to both of our eyes, was, he said, I've made beautiful babies with less. And we're living proof, that that's true.